So there's another crazy type of blood disorder known as what? The paroxysmal nocturnal hemoglobinuria. Okay, so this disease condition has some clinical features or has some things that okay in the laboratory you can able to, not really laboratory, when you examine the patient you can be able to actually what elicit them. All right, so on that basis these are the things that we'll be looking at. The clinical features of what? Paroxysmal nocturnal hemoglobinuria. Okay, so but first of all, we'll be defining this disease condition before we be going to talk about what clinical features. All right, so for the definition now, say that what is the definition? We say that the paroxysmal nocturnal hemoglobinuria is a rare and acquired, okay, that means it cannot be inherited, but it's only acquired. Okay, it's a life-threatening disease of blood. All right, it is characterized by destruction of red blood cells by the complement system. All right, which is a part of the body's what? Innate immune system. All right, so this now there's destruction of red blood cells by the complement system. Okay, and this is part of the body's what? Innate immune system. Okay, so talking about this now, these are like the signs and symptoms of what? This paroxysmal nocturnal hemoglobinuria. Let's basically talk about how it can affect your body. That's the symptoms. You'll be having fatigue and weakness. You'll be having rapid heartbeats. Okay. They'll be having frequent infections. Why will you be having frequent infections? This is because what? Your immune system is weak. All right. Then there could be bruising and bleeding too. There could be headaches. All right. They also be having trouble breathing. All right. They'll be having blood clots. Having blood clots. I'll be having abdominal or back pain. All right. Abdominal or back pain. All right. So that what is a clinical triad of chronic intravascular what hemolysis. That's in this paroxysmal nocturnal hemoglobinuria. There's a triad. Anything triad, that means what? It is characterized by three main symptoms, okay? Or signs, sorry, all right? So there'll be intravascular hemolysis. That means what? Inside the blood vessel, there'll be breakdown of um inside the blood vessel, there'll be breakdown of what? Blood, okay? Then there'll be venous thrombosis, all right? That's bone marrow failure, okay? Then chronic hemolytic anemia. Okay, there may be chronic hemolytic anemia, which may be severe, right? Then hemoglobinemia and hemoglobinuria. Okay, so often episodic and is worse in the morning. Okay, and it occurs what? Intermittently. Okay, then for the so also hemoglobinuria that is now formed will predispose to what? Iron deficiency, because what is hemoglobinuria? You are urinating hemoglobin in urine. Okay, so as you are urinating hemoglobin, that means what? Much more iron is being what? Excreted. All right, so this can lead to what? Iron deficiency and also acute renal failure. All right, so it will also have features of anemia. Okay, bleeding may occur secondary to what? Thrombocytopenia. So basically, you have reduced levels of platelets. So as you have reduced levels of platelets, it will lead to what? Platelets are involved in blood clotting. So that means there will be a defect in blood clotting, and this will lead to what? What is known as thrombocytopenia. Right? So there will be dysphagia and hypertension, and there will be thrombotic events. All right? So that's about the clinical features which may be seen in paroxysmal nocturnal hemoglobinuria. See you guys pretty soon.